Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified internal medicine physician, rheumatologist, and obesity medicine specialist. My background also involves a fourth board certification, which is for integrative and holistic medicine. As a holistic minded physician with integrative approaches, I do get asked a question about low dose naltrexone and what are its benefits for patients who want to take it. Let me start with saying that if you are new to this channel, please subscribe to it. If you find this video helpful, please like it. It would help other people find it. And also, if you have somebody who wants to know about low dose naltrexone, please share this video with them. Um, so, low dose naltrexone, also known as LDN, it's an off-label treatment that has been gaining attention for potential benefits for many variety of conditions, including autoimmune diseases, which a lot of people see me, but there are many other indications that I've used it for, and I will share my experience with you. Naltrexone is traditionally used at higher doses, such as 50 to 100 milligrams to treat opioid and alcohol dependence by blocking the opioid receptors. However, a much lower dose of low-dose naltrexone, like 1.5 to 4.5 milligram, appears to have a different mechanism of action. And as you know, many medicines currently used in practice of medicine are currently approved for one condition, but doctors have found that they have been helpful for other conditions, and we use it what we call off-label use. It's not illegal use, it's off-label use. What it means is that the doctor and the patient have understanding that the FDA did not approve this medication for this reason, but over the course of the treatment of the medication, prescriptions, many years of experience has led doctors and clinicians to know that this medication also has other benefits. Now, every company, when they launch a drug and they get FDA approval, it takes about millions and millions of dollars to go through these clinical trials. So obviously, it is not cost effective for them to get every indication approved by FDA. But as physicians gain experience, they start using the medications in many other applications in medicine. So it appears that low dose naltrexone got used as a low dose LDN, or naltrexone got used as a lower dose in autoimmunity and many other diseases. So in autoimmune diseases, so there are three big category of diseases that it is currently being used: multiple sclerosis, rheumatoid arthritis, and Crohn's disease. In multiple sclerosis, LDN can help reduce the frequency and severity of the symptoms. It improves fatigue and enhance overall well-being in patients with MS. Rheumatoid arthritis, common autoimmune disease. I, as a rheumatologist, have thousands of patients of rheumatoid arthritis that I've treated over years, and they report reduction in pain and swelling. And Crohn's disease, an autoimmune disease of the digestive system, also have small studies have shown that there is some improvement in symptoms and inflammatory markers. Number two, the chronic pain conditions. A lot of my patients who have chronic fibromyalgia, LDN or low dose naltrexone has been reported to reduce the pain, fatigue, and improve their quality of life. So most of my patients who come to me, I at least bring it up at some point in our discussion about the LDN or low dose naltrexone. Another obscure condition is called complex regional pain syndrome. They are now called reflex sympathetic dystrophies. There are some patients who experience extreme degree of pain in one part of the body after an injury or a surgery, and that can be the LDN can be helpful for them. Any inflammatory conditions where you have constant inflammation of the body, you could use LDN to reduce the pro-inflammatory cytokines and modulate the immune system to help benefit reduction of the inflammation. And any inflammatory condition that I see, I can use it at a low dose to see how it responds. Now, in some preliminary studies, this drug has been used in cancer patients as well, because they think there might be some anti-tumor effects. Obviously, this is something that I don't practice oncology, and I would leave this discussion of patients with their oncologist. They've also studied it in neurodegenerative diseases such as Parkinson's disease, and some anecdotal evidence suggests that it improves the symptoms, but more research is needed. Alzheimer's disease, we know that neurodegenerative diseases are growing in population, and we need really good treatments for Alzheimer's and other dementia related disorders. So neuroprotective medications are useful. There's been some discussion about the benefit of LDN in Alzheimer's disease. It has also been studied in depression and anxiety. So mental health disorders is another application for this medication. And LDN has some mood stabilizing effects, potentially through its action on endorphin release and inflammatory pathways. Gastrointestinal disorders like irritable bowel syndrome, which is the hyperactivity of the nervous discharging of the neuro chemicals in the gut system, that can be a problem in some patients. So we treat it with LDN with the low dose. As I said, 1.5 to between 1.5 to 4.5 milligram. Chronic fatigue syndrome, which is also called myalgic encephalomyelitis. I have used LDN extensively in that disease course and gives me some good results. So LDN is believed to work through several mechanisms. Endorphin production, temporarily blocking the opioid receptors in the brain may lead to a rebound increase in the endorphin production, which enhances people's mood and also reduces pain. Number two, immune modulation. LDN may modulate the immune system by reducing the pro-inflammatory cytokine production and increasing the regulatory T cells, which can further inhibit the production of inflammatory responses. And microglial inhibition, by inhibiting this certain type of cells, LDN may reduce the neuroinflammation in the body, which is implicated in chronic pathways of pain and neurodegenerative disorders. So these are some mechanism of actions how LDN can work. Safety and tolerability. One good thing about this medicine is it's generally very well tolerated. Common side effects include some sleep disturbances or vivid dreams. In that case, they're usually transient, they go away. I tell patients to take it in the morning. Some GI side effects and headache. As with any medication, it is important for you to discuss the potential risk and benefits with your healthcare provider before starting LDN. And again, more extensive clinical trials are needed for this disease. Many diseases in LDN, but remember, most companies are not going to invest millions and millions of dollars for a drug that has already been around in the market and has already been used off label. But in any circumstances, if a new trial is released, I will be coming to you back and talking to you about it. Please remember that these videos are for educational purposes only and not a recommendation to start a medication. No patient relationship is established in this video, but it is for your knowledge. And I would like to continue sharing these uh, topics with you for your general information and for awareness of health topics. If you like this video, please like it, subscribe to my channel, and until next video, take care of yourselves.